Hi, my name is Kelsey. I'm a physical therapy student at Campbell University, and today we're going to be talking about doing an anterior glide of the hip. So if we review the arthrokinematics, the femoral head is convex, moving on a concave acetabulum. And so as you move into hip extension, you're going to roll posterior and slide anterior. So this mobilization, according to Dutton, will help improve hip extension and may also help improve hip external rotation. So to perform this mobilization, I'm going to use a variation that we learned in class from Professor Windsor. There's many different ways to do an anterior glide of the hip. I just prefer this one. So you use a mulligan strap and you put it under the patient's leg. And then you kind of strap yourself in there with them. When you're using a mulligan strap, make sure that you have the buckle of it right here so you can easily release it in case you need to, and you can easily adjust how much tension you're putting on it. So for the patient, you're going to have them bend their leg, and then you're just going to use the belt to kind of lift up into a little bit of hip extension if they have it. And your force is going to go right under the gluteal folds, and then you're just going to provide an anterior glide of that hip. So for this video, I'm going to use a grade 3. So that means I'm going to be going until I feel some resistance, and then I'm going to do a long amplitude gliding motion at that endpoint. And this would help increase some of the range of motion and stiffness rather than just working on somebody that has a painful hip. So now I'm going to perform this technique on a patient and try and speak to her in layman's terms. So I've already assessed her hip extension range of motion, and I've noted that it's lacking, so now I'm just going to educate her on what I'm doing. So Cam, I was looking at your range of motion, and when you're going into a little bit of hip extension, so when your leg is coming back like this, you're kind of limited in that area. So this technique is what I'm going to use to kind of just provide some more, provide a force to just kind of get that joint moving a little bit better. Okay, so make sense? All right, so I'm just going to have you lay on your stomach for me. And if you can lift this leg up just a little bit for me. Thank you. You can relax it down. I'm just going to use this strap. It just kind of gives me a little bit more assistance. Okay. Sound okay? Very good. So you shouldn't have any pain or any discomfort with this. So I just want you to let me know if you have any of that pain, and I'll back off a little bit.
Okay.
Okay? So I'm just going to touch you right around here. And so again, I could perform this technique as long as I felt like I needed to in order to get the changes that I wanted to get in the joint and the joint capsule and joint field. And so then I would just reassess for range of motion at the end of it.